Yes, I'm Dr. Craig Booth. I grew up here in St. George. I went to school at Dixie College, University of Utah, finished some training at UCLA before I came back here in 1973 in family practice. I love the old Dixie Pioneer Memorial Hospital. I had trained at UCLA, so it was a huge hospital, and moved back here in a one-hall hospital. You could stand in the emergency room and scream at the nurses down in OB, and they could hear you and do the things that you needed done. That hospital obviously didn't have very many modern things. I remember bringing the first chest tube here, the first blood gas machine, things which we all take for granted today. There was no air conditioning. We had, what do you call them, swamp coolers. And it did get very warm there in the summertime. We only had a one-bed emergency room. We had a one-bed delivery suite, basically, but it still met the needs. There are a lot of great experiences that have occurred during the 40 years that I've been here. But I think the most memorable occurred in the first 2 years when an older gentleman fell at the Senior Citizen Center. A ladder fell with him on it, putting up Christmas decorations, and the rungs of the ladder came across his chest and a couple came across his abdomen. He was probably 83 years old, and the trauma of these rungs lacerated his liver, his intestine, and a couple of the major blood vessels in his abdomen. And you could just see his abdomen expanding as we were looking at him, and he was slipping into shock. And my partners and I, all three of us family docs, but with some surgical training, had to take him to the operating room and repair the liver laceration, repair the intestine, repair the artery. We sweat blood. We probably sweat more blood than he lost, but we didn't know if we could save him or not. But we were the only chance he had. And he survived it, lived another 10 or 15 years, became a volunteer at our hospital, did a great job. I can't think of another instance that stands out in my mind as clearly as that one, and it was more than 30 years ago.